Welcome, my name is Sarah Jane, and I'm going to go through in this live a little bit about what shockwave therapy is. So before I get started, I'm just going to check that I'm live, that you can hear me. You can hear me. So shockwave therapy, so you can see me on this side of the screen, and then on this side to the right of me, I believe, is the shockwave device that we have here in clinic in Kinnan Park in Glasgow. So I'm going to go through a wee bit about the machine, what it's used for, what it's good for, what it can help with, why, what does it do. If you have any questions, just comment, just let us know. So just wait, I'll add this. Ask away. So just ask away if you've got any questions. So in terms of what this can help with, fantastic for tendons. So if you've got chronic tendon problems, this is what it's used for. So it's essentially an effective treatment for upper and lower limbs. Obviously, we're podiatrists here, so we're specialists in lower limbs. But we're also, as well as being a podiatrist, I'm also a trained sports therapist, so we can use it in the upper limb as well. So calcific tendinopathies, golfer's elbow, tennis elbow, greater trochanter pain syndrome, so at the sides of your thigh, so sides of your elbows, if you've got pain here, patella tendinopathy, so at the knee, insertional Achilles tendinopathy, so a wee bit further down towards the bone, mid portion Achilles tendinopathy, so more within the tendon body, so further up, plantar fasciitis, that's a horrible one there. So it can help in a lot of these kind of chronic tendon issues. Now, essentially, shockwave works because it uses acoustic energy, right, essentially, that is penetrated through the skin to that part of your body that's essentially injured. It's not electric, it is mechanical, so it's quite noisy, so I'll show you how it works in a second. It's low energy sound waves, essentially, which increases the blood flow to the injured area. So you're basically bringing more of those properties to help heal the area, especially in tendons where there's not a big blood supply. Hence why tendons over things like muscles take longer to heal, because they don't have a big blood supply like your muscles do. So this is going to encourage that blood to that area to stimulate the healing process. Essentially, shockwave has two main modes of action, right? So essentially, it will essentially help with the pain in the tendon. So if you've got a really sore tendon, say for example your Achilles tendon, which is it's the biggest tendon in your body, and it's the one that most people get issues with. And it's going to essentially desensitize the nerve endings within that tendon. So what that means is that, say for example, you come into us and you had any kind of tendon problem, we know from research that we have to load that tendon. But for many of you, you're unable to follow through with your management plan because you're in pain, so you're not able to do the rehab that you need to do to actually break that cycle that you're in, because it's just absolute agony. So if we can remove that pain or desensitize that tendon, it will allow you to go on with your rehab. So I should say shockwave wouldn't be used just on its own, it's part of a whole treatment plan. So that's the first thing, is it will take away the pain because it will desensitize the nerve endings. Secondly, and probably most importantly, the shockwave cause trauma. Right now, it's a controlled micro trauma. So as soon as you hear that, you think, what? But essentially what we're doing there is the shockwave basically caused this controlled trauma. That's this microscopic trauma essentially in the tendon that we're working. And what that will do is it will stimulate and activate the body's own healing processes. So, I mean, that is what we want, right? But as soon as you hear, it's going to do what? You kind of freak out a little bit, don't you? You think, it's going to be really sore. Is that good for me? The answer is yes. There's tons of clinical evidence supporting the use of shockwave therapy. Orthopedic surgeons, it is that kind of, it's usually second line. Exercise rehab would be first. Shockwave therapy would, if you've kind of failing that kind of rehab. And then just before going for surgery, shockwave, if you can get shockwave that can help you not needing surgery or delaying surgery, fantastic. And we should also say that the NICE guidelines, so the National Institute of Health and Care, approve shockwave. Okay, so and it is used in NHS and private practice. Within the NHS, I'm not entirely sure how you access that, but they do. It certainly is available. So let me show you what it looks like. Would you like to see and what it sounds like? It's a wee bit noisy, so just a word to the wise if you're somewhere public. So first thing I'll do is I'll plug it in. That might help. So this is what it looks like. So you can see the machine here. Okay. So we can also direct it from this little computerized screen here, but generally just use on this. So essentially what we've got here is our handle, and it's pretty big, isn't it? And essentially from here, I can put through different energy, so depending what I'm wanting to put through. So depending on the number of hertz and how many percussions. So hertz meaning the speed of it, and up here, this is the intensity of the shock waves going through. So we can adjust up or down depending what we're doing. Now, usually all the research has shown now that actually starting off less is more. So it can be a little bit uncomfortable. So I'll turn this on. Okay. So it can sound a little bit loud. Okay. And when we're using this, so it conducts through the use of ultrasound gel. So if I show you what I would do, so I'll just show you kind of on a bit of my arm here. It's probably a bit sore for me. So I would put a little bit of ultrasound gel on wherever I was treating. So if this was Achilles tendon, I would do it here. Just a little bit of ultrasound gel. I'm going to turn this down so I don't whack myself. This is the fascia tool that I've got on this. So this tool here, there's different attachment heads that I'll put on, and I'll show you them in a second. But essentially this would be more of a myofascia, so it will disperse the shock waves more out to the side. It won't go as deep as some of the other tools. So for example, this gold one will penetrate a lot deeper than the one I've got on just now, so that will disperse the shock waves straight through. So it just depends what I'm doing and what I'm treating. So I place it on like so, and it just sends. So you can see I'm not jumping out my skin. Those little shock waves through. Okay. So depending on what you're getting done. So if I was using this particular tool, I would be moving it up and down the tissues. But once I'm using the other tool, so if I was utilising, I'll show you, one of these tools. So if I was putting this attachment onto this, then what I would be doing is wherever I'm treating, right on that point of pain or where I want this to focus on, turn that better. So where I want that to focus on, I would be holding it still on that. Usually about 4,000 shots. So there, just in that short demonstration, I actually put through 398 shots. So the shots come out pretty quickly. It depends what I put the hertz at, so how fast I want that to go. But that's what shockwave looks like. It can be a little bit uncomfortable. It's not painless. But it's not, I mean, you didn't see me jumping out my skin there, right? It's just a bit like, it almost feels like somebody snapping an elastic band off you, just like a bit irritating, that kind of feeling. But it's over with pretty quickly, a few minutes. It's not horribly sore. But just again, let's run through what some of the treatments would be for that. So Shockwave is excellent for tendons, so especially chronic tendons. So if you have got an injury that's a tendon injury, then Shockwave may be something that you want to consider. It really is, in terms of clinical practice, research for tendons, chronic tendons, one of the best things that you can have done. In terms of how many treatments you need, now that becomes a wee bit more customised to you, because it will depend. It depends on your injury and how long you've had that for, but usually somewhere around the 6 treatments is what's recommended, usually a week apart, maximum of 10 days apart. Within the clinic here, we would assess you first, so you would book in for an assessment first, and then if indicated, we can then move you on to Shockwave if that was something that we felt was going to suit your needs. You need to really commit to at least the 6 treatments, because really to get that cumulative effect, that's what it's going to take. So you are looking at least about £300 investment, because each session is £50, which is pretty... it's a pretty good price. Go and have a wee research about. That's a pretty decent price for Shockwave. So you would come in, you would have been assessed, and if you're coming in for your Shockwave, what would happen is we'd be working on whatever your pathology is, and your tissue would be prepared. We would usually start with the myofascia tool first. That's the tool that I showed you there. We would loosen out all the associated tissues, not just directly where the pain is, because that wouldn't... Essentially, we want to fix the problem, and the associated tissues will be part of the problem. So we would work the associated tissues. So, for example, if it was your Achilles tendon, we would be focusing around the heel, the Achilles, and also into gastrocnemius and soleus. So your calf muscles would be addressed as well. And we would then use the myofascia tool, loosen that all off. We would then do the Shockwave treatment, and then we would usually finish off with some soft tissue therapy there as well. And if you needed anything else, so like taping or anything at the end of that, that would be part of your treatment within that as well. Usually with us, your treatments are anywhere between half an hour to 45 minutes. So that's how long it would take. And each session would be £50. So you just pay for each session as you're coming in for it. There's no requirement to buy your full package up front, but we will be very honest with you in that saying weekly to 10 days maximum appointment will be indicated. And for example, say you were coming in for plantar fasciitis, we can use the Shockwave to assist in a management plan for that, but it usually wouldn't be the only thing that you would be doing. With that, you'd usually be part of a management plan. So whether that's orthoses, you'll be part of a strength, building up the tissue, general advice, footwear advice, rest, ice compression, all of that stuff, maybe taping. There'd be a few things with that. But just know that we can use it for plantar fasciitis as well as anywhere, essentially, patella tendon, bursa problems around the trochanter, that kind of lateral hip pain, along with tennis elbow and golfer's elbow as well, because remember, we are sports therapists here too. So if you're needing any advice or are worried about where you would get started, don't hesitate to reach out. If you want to get an appointment, I'll pop the link to get an appointment in with this just in the comments. First things first would be to book an initial assessment, and then from there we would be able to see whether or not this would be a suitable modality for you and offer you alternatives. All right, have a good Wednesday and get out and enjoy the sunshine. See you all later.